We're group number 4, and we're going to be reviewing how to do a FAST exam. So, first off, what are indications for a FAST exam? Number 1 is any blunt or penetrating trauma to the torso. Number 2, evaluate for free fluid of the peritoneum, free fluid of the chest, or pericardial fluid. What are some contraindications? There are none. What supplies do we need? We either need a curvilinear or phased array probe, a low frequency probe, and ultrasound gel and towels. So, you're going to be following us today in a step-by-step procedure with the patient supine. We'll be doing right upper quadrant, left upper quadrant, pelvic, and cardiac.
Okay, so we're going to start with the right upper quadrant. The indicator will be pointed towards the head of the patient. Anchor the probe in the mid-axillary line at the 10th intercostal space. It's used to identify the lung, liver, Morrison's pouch, diaphragm, and the right kidney. We do this to evaluate for free fluid in the Morrison's pouch, or also between the liver and diaphragm, surrounding the caudal tip of the liver. A tip is we can ask the patient to hold their breath in to keep the organs from moving and have the probe to fit better. In the left upper quadrant, indicator pointing towards the head of the patient, anchor the probe in the posterior axillary line around the 8th intercostal space. A tip is knuckles to the bed since the spleen is more posterior. This is used to identify the spleen, perisplenic space between the spleen and the diaphragm, and the left kidney. It's used to evaluate for free fluid collecting around the spleen, also in the chest at the costophrenic angle in between the diaphragm and spleen. A tip is also to ask the patient to hold their breath to keep the organs from moving and allowing the probe to fit between the ribs.
Now we're moving on to the pelvic view. For this, you have the indicator pointing towards the patient's right to get a transverse view to identify the bladder, uterus in females, prostate in males, and rectum. You want to tilt and fan the probe to examine the entire pelvis from superior to inferior. Then you're going to rotate the transducer 90 degrees with the indicator pointing towards the patient's head to get a longitudinal view right above the pubic symphysis and point the probe downwards towards the pelvic cavity. You're going to observe the lateral borders of the bladder to identify free fluid by tilting and fanning the probe left and right. Free fluid will accumulate in the rectovesical pouch in a male pelvis and in the pouch of Douglas in a female pelvis. A tip for this is to scan the patient with a full bladder to help visualize the structure.
View here that we have is the cardiac view. The first thing that you'll do is hold the probe in the palm of your hand and use an overhand grip. Point the indicator towards the patient's right, which is the subxiphoid view, and adjust your depth setting to around 15 to 20 centimeters. Next, have the patient take a deep breath in. When the patient exhales, press the probe into the patient's abdomen and tilt the tail of the probe towards the patient's feet, aiming the beam towards the patient's left shoulder. Here you can identify the pericardium, right atrium, right ventricle, left atrium, and left ventricle. And lastly, you can also evaluate for pericardial fluid.